Sink or swim.
Welcome to the podcast that we have strategically named Sink or Swim. And it is about our lived experience with COVID-19 and how it has changed the world around us.
Sink or Swim, a long COVID, long haulers podcast. It's on every podcast platform where you listen to your podcast. Follow, share, like, and leave. Welcome back. This is episode 2 of 2 with Marian Allen, nurse practitioner who treats long COVID, long hauler patients. Well, here we are. Maybe that's a good spot to start. They don't even know what questions to ask.
Right. It's very interesting because sometimes it's interesting how they present to me, right? Because I have people who, somebody who hasn't been sick for very long, maybe a couple months, just is a little bit tired and heard about long COVID and found me. So it's like, okay, I start with them. And then I'll have a patient who has had it for 2+ years and they've been to every single specialist, been tried everything, nothing's worked, and they're coming to me. So I get people from both spectrums. So I always try to approach a patient with, first, do you have anything that is life-threatening? Is there something, do I need to refer you to the emergency department? I mean, are you having stroke-like symptoms, or is there something that's wrong where I'm worried about you having a heart attack or some kind of congestive heart failure? So I think step one is kind of just see where they're coming from. You know, the patient who has been to all of these specialists, well, they've had every kind of lab and imaging that can be done. So then I kind of start from there and get all of their information and kind of build from there. But I think the first is just kind of figuring out where they're coming from. And then I kind of go into, okay, do I need to refer you? Like, are you having very specific just cardiac problems? And then maybe you should see a cardiologist if you haven't already. So a lot of it is just kind of making sure that you fit with somebody that I can help. So, making sure it's nothing life-threatening first and foremost, and then is this something where I can send you, maybe a specialist will work for you, or are you having just neurologic symptoms? And then kind of once I kind of trickle that down and figure out where they are from that point, then I'm using whatever resources I have. I try to, like I said, I do stick with more of a holistic approach. I use Dr. Leo Galland is somebody that I look at a lot. So I follow him. There's the FOCCC is an organization of doctors, and they've really looked at a lot of acute COVID, but they're also looking at long COVID too. And then Dr. Tina Peer, she's in the UK. She's looks at mast cells a lot. So I kind of just look at all these people who I always like to say I try to follow the smart people. So anybody who's smarter than me and I can learn from, those are the people I chase after to just really see what I can learn from them. Taking some of these things that these different people are doing and seeing what symptoms is this patient having right now, and what can I use from these different protocols that people are using to apply to this patient. So that's kind of the medication side of it. And a lot of it is vitamins and supplements. Sometimes I will do prescriptions, but it's not a lot. Sometimes lab work, if they haven't come already with a whole, 50-page document of lab work. And then from there, I have reached out to all different kinds of people to see who can help. There's a stasis breath work. I don't know if you guys have heard of them, but they focus on, it helps people who are short of breath and really focusing on breath work. It's a little bit more meditation. There is an occupational therapist that just reached out to me, which I'm really excited about because I think really having, we tell people exercise makes it worse, so don't exercise, take it easy. And then that's pretty much what we do with that. An occupational therapist is really good at coming in and saying, okay, this is how you do that. This is from the time you wake up to the time you go to bed. Here's a plan of how to conserve your energy and how to pace. Do that every day and kind of build the program from every day to then gradually build up. At first I was thinking, we need to go to physical therapy, but most of these patients, physical therapy is too much. They need very basic, here's how you can get dressed in the morning and conserve your energy so that then you can, walk to the kitchen or maybe walk to the mailbox. It's very specific, starting slow and really gradually getting to where you're increasing your exercise. We look at what foods are you eating. A low histamine diet is really helpful for these patients, a plant-based diet. So it's a whole lot. And of course, I'm dealing with people who have brain fog. So I tell them all of this information and I can't expect them to remember any of it. So I always follow up with a long document of here's all the different resources. And I try to make it specific to kind of what the patient needs, but also we talk together about what, I can tell you to do these things, but it doesn't help if you're not up for it, if you think this is draining. So we really work together and here's a list of options. What do you think? Here's what I suggest, but also I have to have your input because you're the one that has to do it. So it's definitely a team-based approach with a lot of different ways of doing it, very specific to the patient. So it's a lot of information gathering in that first session.
I relate to everything you just said.
Yeah, good. Yeah, I try.
I mean, it's crazy. Where they are. And I know that there's a lot of people that are out there that are going to be listening to this that are going to say, I understand. and it's nice to hear someone that does understand. So this is one spot and we'll do it again later. But why don't you tell people that are listening how to be able to find where you are and how to find if they can see you or seek you out for treatment?
Yeah, so my website is long COVID NP, NP standing for nursepractitioner.com. I'm on Facebook, I'm on Instagram, although I'm not great at Instagram, but I'm learning. So you can find me on either one of those. But my website, you can go straight to it. I try to make it very easy to use. There's a button, you can request a telehealth appointment. If you have questions, I have a phone number there. I have an email. I'm usually pretty accessible by email for people who have questions and are just trying to figure out if this is a good fit for them. So I'm happy to answer questions.
And just for everybody, again, that's longcovidnp.com. NP stands for nurse practitioner, so longcovidnp.com. And go ahead and tell everybody and spell so that when they do look for you, tell everybody your full name and spell it for them.
Yeah, it's Marian Allen, and first name is Marian. Last name is Allen. It's Allen.
Okay, and just in case you skipped past the very beginning, and I'm talking to the listeners, Marian is a nurse practitioner, and through her research and her own hard work, she's working very hard at trying to help those of us that are long haulers, long COVID, and being able to figure out what's going on and figure out some type of treatment regimen. So let me ask you this question. Mm-hmm. If they say, I've tried everything prescription-wise, but what can I do to help with this pain? A lot of long COVID, long haulers that they get exhausted, they get depressed, they get anxiety, they get everything, and it is exacerbated because of the pain. And the pain is not what most people understand as pain, because most of us can't describe what the pain is. And I know for me and a lot of others, we've tried the narcotics, we've tried the anti-inflammatories, we've tried all of the arthritic medications, or at least why say a huge number of them. What do you say to those people for options, or what's the next step, or is there something additional? What do you say to that patient?
Yeah, well, it's really figuring out, are you, and not to say that people aren't in pain. Obviously, I believe that they are. But if these things aren't working, is it your brain telling you you're in pain, but it's not really pain? So really trying to figure out, why is your brain telling you that, and how can we fix it? Cognitive therapy can be really helpful. And then again, some of these resources that I kind of talked about before with maybe some brain retraining, maybe for some people, the breath work really, and the mindfulness and meditation can really retrain your brain and help with that. So I guess it really depends on what kind of pain the patients are having, what have they tried, because sometimes maybe they do need some pain medicine and that can resolve it. So I guess starting with a lot of, is it true pain, or is it something that it's your brain firing off these pain responses? So really starting there, and I've found that cognitive, behavioral therapy can be helpful for that. If it is the latter, where it's just your brain telling you that you're experiencing pain.
And then the next one I would say is, and it seems to also be kind of a predominant thing that a lot of people have openly discussed, a total exhaustion, brain fog, concentration, that kind of stuff, that direction. What generally are you saying to patients in regards to those issues?
Yeah, a lot of that is, with just about everything else. And we tell people, just push through it, keep exercising, and you just have to push through it and it'll be fine. And so that's just stuck in everyone's head. So I think doing the complete opposite, actually exercise is making this stuff worse. So that's where I'm really excited to get started working with an occupational therapist that really focuses on a very specific plan each day about how to conserve your energy. If you only have 10% of the energy that you had and you use 6% of it before you even get out the door, then you don't have anything left for the day. So really having a concrete plan of how can we conserve energy, I think is going to be the most helpful. Some of these supplements are helpful because they actually help the mitochondria of your cell, which, if you remember from science back forever ago, mitochondria is the powerhouse of your cells. So a lot of these supplements actually boost the mitochondria in your cells. So those, of course, can be helpful for people who are fatigued and just have zero energy. So those can definitely be helpful. But I try to do as many things as we can. So yes, we can give you supplements, but let's also have a plan because I really think it helps people be proactive in their care. They can take medicine and it'd be helpful, and that's great. But I think people really want to do something, especially patients like yourself. You've been sick for years now, and these patients come, they're desperate for any help. So, they will take the supplements, they will do whatever you tell them to, and they want to be proactive if it means that they are going to have relief. So, working with them, I think it helps them a lot, because you have them that they really want to help and they want to be proactive. So it gives them something to do, and it also obviously can help, full picture. So I think it's a multi-level approach to be able to do it.
You do holistic care, so I know that what we put in our body makes a difference to you. How, for somebody that everybody looks at the internet, but you can't believe everything you see on the internet. We all know that.
Sure.
How do you educate patients about what they put in their body? And I'm talking fluids, food, anything that they buy or get out of the store or any of the health food locations. How do you help people determine what goes in is going to result in a certain manner of what comes out?
I try to keep it as simple as I can. We don't need, you get all these diets that are so specific. And I had someone who they went on a very specific diet and lost a whole bunch of weight, which they didn't need to lose all of that weight. So you have to be careful. You don't want to be so restrictive. So I try to make it as clear and easy as possible. It's really just plant-based foods. Just shopping on the outside of the grocery store is the easiest way to put it. Anything within the aisles is going to be processed. So trying to eat, fresh vegetables, trying to stay away from meat. And I always tell patients, I don't expect you to get it all right. It's okay if you mess up. If you want to eat meat, sometimes I'm not saying you have to be a vegetarian or vegan and you can never eat meat again, or you can never, have a bag of chips. I think that's just unrealistic. So it's okay to mess this stuff up, but if you can stay eating a plant-based diet as much as possible, that's going to help. And then specific for long COVID, it's found that it's a lot of histamines going throughout your body. What helps with that is eating a low histamine diet. And I actually send a really good list. I got it from Dr. Tina Pierce, her list of, it lists almost too many foods that you can choose from that are low and high in histamine. So I send patients this list and they can look at it and look up any food just about they want to, and it lets you know, is this high or low? So then you have something concrete to go by. But basically, low histamine is sort of a diet that people, if they have acid reflux, they avoid. So like sauerkraut and acidic things, lemon and tomato sauce and things like that actually have high levels of histamine. There are some kind of specific ones that I sometimes have to refer to the chart myself. But yeah, the most important thing I try to tell people is fresh vegetables, plant-based, shop on the outside of the grocery store, and a low histamine diet.
What encouraging word can you give to the patients who say, I don't know which is worse, dealing with the long COVID or trying to be where I get to do nothing fun?
Where you have to do what now?
Where I get to eat nothing fun, do nothing fun. I have to, I'm sure you've had these patients say, oh, I have to give up all my food that I love. I have to give up all of activity. I have to give up. What do you say to those patients? Because it's like, that's the feeling that a lot of them have.
Yeah, and that's where I really try to meet patients where they are and be very understanding. I'm not perfect. Believe me, I will, mess up and eat things I shouldn't. And I'm the first to admit that I am not perfect. So I understand, sometimes that it's easier to grab something, but I have found that patients are just so desperate to feel better that they'll usually sacrifice. And I'm not saying this is forever. I mean, ideally, yeah, this is forever, but it doesn't have to be. So it's okay to mess up, and that's fine. That's part of this entire process and journey. I'm, myself going to mess up sometimes. So I definitely don't expect anybody to be perfect, but if you can, the more knowledge they have, the better. So sometimes I wonder, am I overwhelming people with all of this information? But I think that if you understand why, why are you telling me not to eat, sauerkraut? Well, it's high in histamines, and histamines are in overdrive in your body. So if they really understand why I'm telling them to do something, it makes them a lot more compliant.
And I will say that we've talked to a lot of long haulers, long COVID, people that are dealing with it on a regular basis. They self-educate very well because just like you said, we are so desperate, really is a good word. We are so desperate to be able to get some relief that we're almost willing to try anything, even some of the stupid stuff that's on the internet. And the willingness to do what it takes is what I guess I would share with my fellow long COVID, long haulers. The willingness to do what it takes, because it really sucks where we're at. It's not worse doing the right thing. It's going to make some of these signs and some of these symptoms maybe not even resolve, but maybe get better for a day or two. I would encourage everybody to do what some of the things are that you're talking about, what we eat, what we do, our activity levels, all of that. It all plays into it. Until we learn more, we only have what knowledge we have today. And that's the best answers that you, the providers, can give us, the long COVID, long haulers. And it is what it is. And we just keep marching forward, walking forward, taking the steps forward, listening to the people that we trust, and just keep going, because that's what we have to do. Is there any last words or anything that you want to cover that we have not covered?
No, I just want to say I'm lucky that I have not had long COVID. So I have so much respect for people that are being told there's nothing wrong with them, get over it. And not only are they dealing with that from a mental standpoint and then from a physical standpoint, and then they're having to still go to work and maintain their finances. So I just I can't say enough about how much I respect for you and everything. And of course, your family too. It affects them. So I just, my heart breaks and I want to do everything I can to try to help and do what I can. So I thank you for just letting me hop on and kind of talk and tell my story and hopefully keep moving forward.
Absolutely. And it's been an honor to be able to talk with you. Tell everybody one more time how they can find you, how they can reach you.
My name's Marian Allen, and my website, you can find me. It's Long COVID NP, stands for nurse practitioner. So it's longcovidnp.com. I'm on Facebook and I'm on Instagram as well. So you can email me or message me from any of those platforms. And I'm usually pretty close by and able to respond with any questions.
And is it the same on Facebook and Instagram, Long COVID NP?
Yes, it is.
Okay. So it's at Long COVID NP on Instagram and Facebook.
Yes. And actually the spelling, just for whatever reason, Facebook has a lot of rules as far as saying the word COVID. So on Instagram, it is Long COVID NP. On Facebook, I've had to tweak the spelling a little bit. So it's actually Long CV-19.
Oh, okay.
Yeah, so that's how I had to get around that. But
you also have your name. You also have your name there on Facebook too.
Yes.
Okay.
So hopefully it's pretty easy to find. Apparently Facebook doesn't allow COVID, I guess.
Okay. Well, Marian, I appreciate your time, your attention, your willingness to share. I really appreciate that you are one of the healthcare providers that has taken an interest in the long COVID long haulers. It's hopefully going to expand elsewhere across the country, but until it does, I appreciate your willingness to talk with us. And don't be surprised if you hear from some people in other countries also, because I think we're near 30 some countries now that actually listen to the podcast. So I would not be surprised if you hear from somebody that is in some of the foreign countries that listen to us as well. So I appreciate you.
That's great.
Yeah, it's crazy. It's all around the world. I mean, it is absolutely crazy how it's everywhere. And I mean, the only ones that don't seem to be picking up the podcast are in the very, very, very controlled areas that they just don't get to search certain things as a result of the control of their internet within that country, which is a couple handfuls of countries. But we're pretty close to 30 or more countries now that people are listening from. So I appreciate you. I thank you for your time and your attention. And I'm sure probably somewhere down the road, we might get the opportunity to talk with each other again.
Yeah, Marian.
Yeah, absolutely.
We appreciate your dedication and your passion to try to help some of our friends that are listeners across the world. You know, we've been through a pandemic that's definitely a global pandemic that's caused all this. So just like Doug said, we've got listeners all over the world. We're all searching for some of the same answers. We just thank you for the work that you're doing. Yeah.
Sometimes I say I wish I would have chosen something easier than this, because this is so hard. I kick myself sometimes for doing this, but no one else seems to. So I just felt like I needed to.
Well, I really appreciate it. I'm glad you chose to, or you were chosen to do it. Whichever way it is, I'm glad you took on the feat of attacking this.
Yeah, well, thank you for saying that.
Have you ever noticed that Sink or Swim is abbreviated SOS? Sink or Swim, a Long COVID Long Haulers podcast. SOS. Many of us are screaming SOS from the mountaintops, trying to find answers, trying to get people to understand, trying to understand ourselves what it is that we're dealing with. I'm Doug. I'm your co-host with Sink or Swim, a Long COVID Long Haulers podcast. My co-host is my wife, Stacy. We are honored to bring you a series of interviews with people from all around the world, from different professions, different experiences, but all having a lived experience with COVID, chronic COVID syndrome, a long hauler, long COVID issue. Please join us. Please follow. Please like and please share. These interviews will bring enlightenment to everything that we possibly can about the experiences we live in, about what we might be able to obtain for treatments, and what the knowledge is that we know up to the point of the interview. These are people that can bring information to you and those that are trying to understand what you and I are going through. Join us for this series of interviews. They will come in separate episodes from each interviewee. Each interviewee is excited to be able to bring you what they can share from their own experiences, from their own knowledge, and from their own ability to try and help you and me. Thank you for listening. Please follow, please like, and please share. Welcome to Sink or Swim, a Long COVID Long Haulers podcast.